Hello from the Finlandia Village Fitness Center. I'm PhysioJo here with your health info talk number 2. So we just finished talking about posture of the upper extremity, upper part of the body. Now we're going to talk about your posture in your lower body. So there are a couple of different poor posture positions people can get into, and a lot of it has to do with past medical history, past injuries or things that have happened before. If you've had a hip replacement, a knee replacement, or you have arthritis in one of your weight-bearing joints, or you've had back pain for years, your posture will not be perfect. And I'm going to use this point in time to say no posture is perfect. I've never met anyone that has perfect posture. Little kids that are just starting to walk are very close to it because they haven't really picked up on any bad habits or repetitive movement or training in sports to really throw them off. But it doesn't take long before our bodies start to adapt to our environment, which throws us off. So there are, even though you may say, oh my God, my posture is terrible, I've known that for years, doesn't mean that it's not possible to work on improving it. To make it perfect, not my goal, shouldn't be your goal either, but to be able to improve it, to make movement, function, and everyday activities a little bit more comfortable because it might help with some pain, or just knowing that it could prevent some future or further injuries or aches and pains from coming on should be a bonus right there and something that you're going to work towards. So what does abnormal or bad posture in the lower extremity look like? One, a very, very common one is standing on one foot. And so many people do it, especially if you have any kind of arthritis or issues with your knee, hip, or ankle, you're going to be standing on one leg, or even the back. So you have back issues, you have sciatic pain going down the one side. As soon as you put weight on that one leg, that pain shoots right up into your back. That could be a very typical posture for you. Another typical one that we see is not talking. So we can look at the feet and say flat-footedness versus somebody that has a high arch, bunions, all those things. In my opinion, that stuff that's happening down there in the foot is usually secondary to something else that's going on. So we're not going to focus too much on the feet today. We will talk a bit more about the pelvis though. So typical pelvic issues that can give problems is when your pelvis is rotated too much to one side, like forward or back, or hiked up or too high or too low. Doesn't matter what it is. You don't need to be diagnosed with an actual term that goes with it. If it's off, I'm going to show you a quick way to check. You don't even have to check and see if you're off. You just want to try to get your body into the most ideal position. That's probably the best tip that I have for you, regardless of whether it's anteriorly rotated, posteriorly rotated, hiked up or down, one leg shorter than the other, longer. To me, if I was treating you as a physio, it would be important to know. But in this instance, for what we're talking about today, I just want you to try and put yourself in the most ideal position so that all of your muscles and all of your other joints can produce movement and get you going from a good, stable foundation. Now, okay, so let's talk about pelvic instability, pelvic postural problems or instabilities that I see often. Number one is a pelvis that's tilted anteriorly. So that would look like this. So bump kind of up in the air, that would be a pelvis that's turned, tilted forward or anteriorly. Okay, tilted back. The ones that have more a posterior tilt, it happens. Not that common, but it happens. And these people here oftentimes are the people who have a little bit of excess weight there, and it really forces their lower back to be curved inwards a little bit too excessively. So what's the best position for your pelvis? It's when it's neutral. Okay, so your pelvis wants to be in a neutral position. In a neutral position, it's a lot easier for you to recruit the proper muscles that are designed to help you initiate movement and help you recover if you're about to lose your balance, that kind of stuff. Okay? So, what is a neutral pelvis? Simply stated, it is when your pubic bone and your tailbone are level at the same point. So if I, in this position here, if I tilt my pelvis forward like that, my pubic bone is higher than my tailbone. If I come here to a middle point, my pubic bone and my tailbone are level. If I go too far back and I tilt posteriorly, now my pubic bone is higher than my tailbone. What you want to do is try and get those two levels, those two bones level in a neutral position. So I'm going to give you a little exercise for you to do related to this, just to get you, to make it easier for you to get into that position. I want you to rock your pelvis forward and back, okay? So you're tilting it back and you're tilting it forward. Tilting it back and forward. Go to the two extremes as best you can, okay? And now I want you to stop when you feel that your pubic bone is level with your tailbone. That's a neutral pelvis. That's the position that your pelvis wants to be in. So anytime you're standing, doing something simple, brushing your teeth, brushing your hair, something like that, put yourself with your feet shoulder width apart, toes pointing forward as much as you can comfortably do so. If you're someone who's walked with your feet turned out, like at around towards, I'll say 10 and 2 on the clock, if your feet have always been pointed out like that while you're walking, it may be more difficult for you to put them straight. If you can put them straight, go for it. I've always walked this way, I don't buy it. You probably just don't remember way back when your feet were perfectly aligned. So we can work on getting that just by slowly putting your body into those positions to slowly get some stretch out of those muscles. So you're thinking posture, you're brushing your teeth, you're talking on the phone to your loved one because this is the way we communicate nowadays. Feet are pointed forward, shoulder width apart. Find your neutral pelvis, so tilt your pelvis forward and back until you feel that your pubic bone and your tailbone are level. And now I want you to stay in this position while you're brushing your teeth, while you're doing things. You may, in this position, feel your core muscles engage. You may also, in this position, feel your bum kind of wanting to kick in to help out to stay in this position. That's okay. That's good. When we do our postural exercise video class, we're going to be talking about those muscles. So if you're not sure what your core is or how to engage your core, we're going to create an exercise video just about core, just about those muscles there and how you are going to progress yourself through them, because we may be apart for a couple of months. I want to make sure that you have the ability to progress yourself through those exercises at home if you wish to do so. So all of the exercises that you need to do are going to be either in the postural video or specifically that core one. So you will learn how to engage the core. We're not going to get into that today, but I want you to know that when you're in this good neutral pelvis position, your bum muscles might want to kick in. We'll teach you how to get those gluteus maximus, get those muscles stronger. We'll teach you how to do that. But if you feel them want to kick in, go for it. Squeeze them while you're in that position. Nothing wrong with that. And your core as well. So if you feel some tightening in your stomach, that's okay. Go for it. Use it. Try to squeeze even harder. We'll get into those details later, but these are just little things that you can do right now. So that's it. That's all I want to talk about today. I don't want it to be too complicated or too long, but your tip for your neck was to lean your head back. Your tip for your lower body is to try to put yourself in that neutral position of the pelvis anytime you're just standing. Don't worry about doing that when you're walking, because you need for your pelvis, like the left versus the right side of the pelvis, to rotate separately. So as you take a step with your left foot, that side of the pelvis is going to rotate back, and vice versa on the other side. So don't worry about holding it stable when you're walking. When you're standing, talking to someone, you do that. And if you have any kind of pain in your hips, knees, ankles, back, and you find yourself often standing on one foot, shifting your weight all over to the one side, try to limit the amount of time you do that. Try to shift your weight so that you're 50-50 on both legs. You're going to run into a lot of other problems and pain elsewhere the longer you keep yourself in that position. And as a physiotherapist, I can tell you exercise is a really, really good way of dealing with pain and prevention. So I love it for treatment, but I also love it for prevention. So for some of you, I hope you take this as a way to try to start helping yourself and treating yourself of pain. If it feels good and it makes some of your pain go away, good. You're treating yourself through exercise. Bonus. If not, know that you could potentially be preventing other areas, other injuries and issues from coming up by ignoring the fact that bad posture and bad technique when you're doing certain things can lead to secondary problems in other areas. That's it. Oh, you know what? No, I have one more thing. I just spotted my ball behind me. I'm going to back up and try not to wipe out. So I have a physio ball here, and I'm showing you this because I know a lot of people have these. So this big purple ball, I am sitting on it. Anybody who's got one of these hiding in your basement, your kids gave it to you because it was a fad at one point and you don't really use it much anymore, pull it out. Especially if you're working on this kind of pelvic stuff that I was talking about. The best way to get your pelvis to rotate forward and back, and those of you who have a hard time going forward and back, it's just from not doing it. If you've never done it before, it'll take a while before you get the hang of it. So just doing it and standing, you'll start to loosen up the muscles that are tight and kind of wake up the ones that are designed to do that motion. If you're having a hard time standing and you have a ball, sit on it. Just rocking your pelvis forward and back like this on the ball will allow you to have a lot more movement than if you're standing. And here you can feel, as you rock back, I can feel all the weight on my tailbone. As I rock forward and I push my bum back, I can feel all the weight in my front. So you're really going from one extreme to the other, rocking on your pelvis. Do this a couple times a day, and you're going to notice when you're standing up, it's going to be a lot easier for you to find that neutral position. If you have one of these at home, pull it out, leave it in your living room. And I imagine that with this self-isolation that we're doing and the distancing, you're spending a lot more time in your house or apartment than you normally do. So you're probably watching TV more. You started to watch a Netflix series, or you're back into soap operas, whatever it is. If you're watching a lot of TV or even on your tablet or on your phone, sit on your ball. Rock back and forth. You can even rock side to side because maintaining movement in your pelvis this way is also a very good thing to do. But once you're done rocking forward and back, find your neutral position, and it's where you feel the weight is evenly distributed on your, we call it ischial tuberosities. You guys probably know them as your sits bones. It's evenly distributed side to side and forward and back right there. In this position, just stay there. You have to engage your core muscles to be able to sit on a ball that doesn't have a backrest like this. So you are working your core muscles just by sitting here. You can bounce up and down because what you're doing is this, a compression and decompression of the discs, which is not a bad thing. Your discs actually like that. Gently, softly, don't fall, please. Have something close by in case you lose your balance. But any kind of pelvic movement on the ball or just sitting on it with the back straight, engaging your core muscles, is an excellent habit to get into. Now I think I'm officially done. I can't think of anything else that I wanted to say, which is fine because we're at the 14-minute mark. So I hope you enjoyed this video, and stay tuned for what's to come. Bye. Stay safe. Wash your hands.